Thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson, and I'll be your host today. Our webinar is on ensuring access to high-quality, affordable early care and education for low-income families, and we're fortunate to have a wonderful panel of speakers today. First off, we'll hear from Dr. Julia Henly, who is a professor in the Crown Family School of Social Work, Policy, and Practice at the University of Chicago and is an IRP affiliate. She'll share the early care and education challenges facing low-income families, the different ways to define access and childcare through an equity lens. Next, we'll hear from Dr. Yoonsook, Associate Professor and Social Welfare Policy Coordinator in the School of Social Work at Boston University. She'll discuss the benefits and challenges related to accessing high-quality childcare through subsidies. And then we'll wrap up the presentations with Gina Adams, who's a senior fellow in the Center on Labor, Human Services, and Population at the Urban Institute, and she also directs its low-income working families and kids in context initiatives. She'll offer her perspectives on what can be done to ensure access to high-quality, affordable early care and education for low-income families. Again, thank you all for being here. I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their partial support of this webinar series through their funding of IRP as the National Research Center on Poverty and Economic Mobility. We have an hour today, and after we hear from each of our presenters, we'll spend the last 10 minutes or so for a live Q&A. You can type those in through the Q&A box, and we did get quite a few questions submitted as you all registered, so we will be queuing up some of those as well. And I hope you'll also feel free to participate through the chat. As I said, we'd like to know who you are and where you're joining us from. Also, we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. And we'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. Also in that email, we'll include information on our October 18th webinar, which will be about the early care and education workforce, so a really great complement to our topic today. So with that, thank you again for being here, and we'll get started with Julia Henly.
Thank you very much. Can people see my slides? Does that look okay? Okay. Can you hear me? Can people hear me?
Yes.
Okay, great. All right, so I will get started. First of all, thanks so much. It's great to be here. It's also great that IRP is doing this webinar series on what I think is a really important and critical topic. I also want to say that I have to excuse myself after my presentation. I had a last minute emergency and I'm going to need to run off. So you will be definitely in the capable hands of Yoonsook and Gina for the Q&A, but I'm really super sorry to miss it. Okay, so I'm gonna, as Judith said, talk about today what I see as kind of the big contours of the childcare and early education dilemma, and from the perspective of families who are trying to access care. And then at the end, if there's time, I'll say a little bit about what I see as some of the additional equity challenges with childcare access. So childcare, as you all know, is a critical work support for parents. 2/3 of parents work. 70 outside the home, we all work. 75% of children are in care when their parents are employed. And we have really pretty strong evidence that high quality, stable childcare is associated with improved employment outcomes for parents, as well as for family economic well-being. In addition, childcare is an important investment in children. Early education supports cognitive, emotional, and social development of children in the short term, as well as the long-term well-being of both kids and society. Childcare is also an important industry. It's central to a vibrant economy, both because childcare is a necessary support to working parents, but also because the childcare workforce itself is a significant sector of the labor market. But we face a real childcare challenge in the United States. While it's not a new dilemma, we're confronted today with the challenge of developing a system of childcare and early education that serves the needs of working parents and the developmental needs of their children, while at the same time providing caregivers and childcare owners stable, high-quality employment. For families, it's a problem of finding affordable, high-quality care that's accessible and that meets both parents' work needs and children's developmental needs. For childcare providers who are disproportionately low-income women of color, the problem is one of low wages, limited benefits, poor work conditions, and high turnover. And this is true across all sectors, licensed and unlicensed homes, as well as centers, preschools, nursery schools, et cetera. Beyond frontline staff, childcare programs operate on small profit margins. They rely primarily on revenues from tuition and fees, and in some cases, government subsidies and philanthropic dollars to help cover staffing and operational expenses. So there's this long-standing conundrum. While childcare expenses are unsustainably high for many parents, market rates may be too low for providers to cover the primary costs, whether staff, facilities, supplies, without substantial public investment. And childcare subsidies, as Yoonsook will discuss, reimburse providers below the market rate and only cover a fraction of eligible families. These conditions make it difficult for childcare businesses to invest in program improvements and professional development for staff or to extend their services to harder to serve families. And Gina will talk more about this later in our presentation. Thus, many economists, such as Liz Davis and Aaron Sojourner, talk about how the current market system is unworkable without substantially increasing government support. So in the rest of my talk, I'll focus on the particular challenges facing families seeking care. It's useful to think about the diverse dimensions of these access challenges. I'll frame my presentation using the Administration for Children and Families, OPRE, or the Office of Planning, Research, and Evaluation's definition, which is a multidimensional definition of access. These access dimensions, I might add, also align really nicely with the key decision factors that parents use in their search for care, as has been demonstrated in several studies. So the first thing I want to talk about, the first dimension, well, it has to do with affordability. So while childcare is a challenge for most families, it's especially difficult for low-income families who find affordable, high-quality care. To illustrate this, these dark blue bars on this graph from the Council of Economic Advisors, the dark blue line, indicate the percentage of families using care, whether or not they pay for care. And the royal blue bars are families who pay for care. The point here that I want to make is that most children are in non-parental child care. Most children whose parents work are in non-parental child care. And there's an income gradient such that families with higher incomes are more likely to pay for care than families in lower incomes. But of those who pay, low-income families shoulder greater childcare burden. I think this is really important and sometimes gets lost because of what we learned in the last slide. So families under $25,000 pay 31% of their household income toward childcare, and families over $150,000 pay 8% of their household income for childcare. These are families that pay for care. So Yoonsook will talk more about then how the childcare subsidy system responds to this affordability challenge. In addition to affordability, childcare access is also it's important to achieve childcare access that we have a system that meets parents' needs with reasonable effort. That is, how convenient is it for families to find and use care? And here, just really briefly, I could say a lot more about this. The key challenges related to convenience include finding care that's conveniently located to a parent or a family member's home or work, finding care that aligns with family routines and schedules, and finding an arrangement that fits the needs of multiple children, maybe a 9-month-old and a 3-year-old and a 9-year-old. So convenience is a key access factor that I think we need to think much more about as we try to build a sustainable childcare system. Another aspect of convenience concerns the work schedules of families. And I want to spend a little bit more time, both because it's one of the things I study and also because I think it's super important. So families needing care outside of daytime weekday hours face particular challenges. Non-traditional hour work is relatively common across income, as the red box indicates. And 60% of children are in childcare while their parents are working during non-traditional hours. We actually know very little about the kinds of care families prefer during non-traditional hours, although Gina Adams and her colleagues at Urban did a great study on that, so maybe you can ask her in the Q&A if you have questions. But we really don't know what kind of care parents want, and it also probably depends, as they found out, on what hours of the day or week you're talking about. So the supply of non-traditional hour childcare is almost entirely unpaid or paid family-friended neighbor care, that is informal care, unlicensed care. Most childcare programs, as this slide shows, do not operate during non-standard hours, nor do they offer drop-in care or care on irregular schedules. It turns out that early morning opening hours are more common than other times of day, which really means that 8% for centers, most of that is for early morning care. If you have weekend care needs or overnight needs, you're unlikely to find care in a center or even a licensed family childcare home. So let me just go right to here. So low-income kids spend a great deal the other piece of this is that low-income kids spend a greater share of all their childcare hours in non-traditional hour care. So just to clarify what this is saying of all your childcare hours, what percentage of them are during non-traditional times? And as you can see, kids living in poverty, 27% of the share of their hours are during non-traditional time, compared to 13% for families living at 300% or above income. And this is some analysis we did with the NSECE just a couple months ago. This is the 2019 household NSECE, for those of you that are familiar with it. Finally, I'm moving away now from meeting needs to another access dimension, and that is trying to find care that is high quality and that meets the developmental needs of children. There's a lot I could say about access challenges to quality care, and I know this came up in some of the Q&A questions that we got ahead of time. I don't have time to say too much here, but let me just say that there's reasons to consider investments, I would argue, in quality across all sectors: informal family friend and neighbor providers, licensed family childcare homes, and a whole range of licensed and unlicensed centers. Importantly, if you look at conventional definitions and assessments of quality, we know that most programs, regardless of sector, are of low to moderate quality. Importantly, this is true across sector. There's a huge range of quality in any sector. So you can have a super high quality informal grandma taking care of your child, or you can have a super terrible center, and vice versa. I think that's really important to remember. In addition, investments in Head Start and pre-K have significantly increased the availability of low-cost quality early care and education. And I see that as a really important change in the last 15 years that we should not forget. On the other hand, I also think it's important to not see Head Start and pre-K as the answer to our early care and education problem on its own, because childcare is both a work support and a tool of child development, and investments in quality may not translate into work supports for parents. In fact, many Head Start and pre-K programs do not align with parents' work schedules. Finally, definitions of quality vary. This was also a question that came up in one of the advanced Q&A questions. I think it's really great that there's a growing recognition and that we may want to use different definitions of quality depending on the sector, depending on the purpose, and depending on the time of care. And right now I'm working with a group at the Erickson Institute, Juliette Bromer's leading this, to come up with a new definition of quality that makes more sense for non-traditional hour care. So through an equity lens, we've already seen that access challenges are particularly serious for low-income families and for families who work non-traditional hours. In addition, there are several other subgroups who are underserved by the current childcare and early education system. I don't have time to talk about all these subgroups, and I'm sure you can add some more to them. The point I want to make is that when you add all these groups up, the majority of children are underserved by our early care and education system when using this multidimensional definition of access. So I think we have a long way to go, but I think we also have a lot of really smart minds, and hopefully we can get some resources, which Gina will talk about, to actually move the needle. I will turn it over after having laid out some of the challenges facing low-income families seeking care. I'm going to turn this over to Yoonsook now, who will talk about our nation's primary childcare subsidy program, the Child Care Development Block Grant. Specifically, in recognition of the high cost of care and the importance of childcare as both a work support and a tool of child development, CCDBG was developed to increase access to affordable, high quality, and stable care for low-income families. It's a vital part of our childcare and early education system and a critical safety net for children. And I'll just leave you with this little quote from a person in one of my studies, actually several years ago. But she says, if this program, meaning CCDBG, didn't exist, I wouldn't be able to work. I wouldn't be able to afford childcare. There's a lot of things I wouldn't get accomplished if I wasn't eligible for the childcare subsidy program. So with that, I will turn it over to Yoonsook.
Thank you, Julie. Okay, let me share my screen first. Okay, here we go. And then, all right, so can everybody see the screen and can hear me? All right. Thanks, Julie. So in this presentation, I will talk about maybe 2-minute version of the overview of the childcare subsidy programs, and then also discuss the benefits and challenges related to childcare subsidy programs. Oh, I'm sorry. I think it's I don't know, alert. It's a national alerts system working. So discuss the benefits and challenges related to childcare subsidy programs based on the research I have done and then other existing literature. Then if I have time, I will briefly talk about progress we have made so far with subsidies and then the opportunities to improve. So, the Child Care Subsidy Program is a jointly funded program by federal and state government, but the significant majority of funding comes from Child Care and Development Fund, CCDF. And the program goals are to promote parents' work and then education, and then also to increase positive child development by increasing access to high quality care. So in 2020, about $13 billion were spent on providing subsidies to about 1.5 million children from low-income working families or other marginalized groups, such as children whose families are in poverty, or children involved in the child welfare system, or children from families who are homeless. And depending on which state you are in, these subsidies are available through either certificates, grants, or direct contracts with the state agencies. And because CCDF is a block grant, under the federal guidelines, the states are allowed to set their own rules based on the needs of their states. And those detailed policies for subsidies are very different by states. So I'm going to actually give you an example. So the state payment rate, we also called it as a state reimbursement rate, and the family co-payment rates are widely different by states. So as an example here, so let's say that private pay price for one child in the center-based care is $1,000 per month, and the state pays 75% of the price for the child using subsidies. That's so 75%, which is $750, include both state share of the payment, which is, let's say, $650, and family co-payment, $100. And then there's a gap on top of that between the state payment and private price of care, which is $250. So as you can see here, each state can have, and then they have different rates for the state share part and then family co-payment. Also, in some states, they allow the childcare providers to charge the gap between state payment and the private price of care. Therefore, depending on how they set the state rate and the family co-payment, and whether families can be charged for the gap, it can have significant implications on the supply of providers who are willing to serve subsidy-receiving children and the affordability of care for families. So now let me talk a little bit about benefit and challenges of subsidy programs. So in family perspective, evidence is strong in that receiving subsidies are likely to reduce financial burdens of the families related to affording childcare. And then it also supports parental work, such as increases in the likelihood of being employed or working more hours, higher earnings, and also they are likely to experience less childcare related disruptions at work. Studies also find that subsidy receiving families are more likely to access to high quality care compared to families with the same characteristic but not receiving subsidies. And use of subsidies also improves social and emotional well-being and school readiness, but we have mixed findings on the impact of subsidies on behavioral outcomes. And a significant percentage of children using subsidies, as I said before, are children involved in child welfare system. So studies focusing on that population also find that subsidized care use is likely to reduce the risk of child maltreatment and increase the overall family functioning. So despite of all this evidence on the benefit, there are also significant challenges associated with the programs. So only 16% of children who are eligible for subsidies actually utilize them. So which is a tiny percentage when you think about it. And then among those who use subsidies, they typically receive subsidies continuously for a short period of time, more than less than a year, as you can see in the table. And many children are cycling on and off the program more than one time, which means that they are using subsidies and then off and then on again and off. So there's a significant amount of churnings in the system as well. Additionally, as we saw earlier, utilizing subsidies can be still unaffordable, even for families who are eligible in many states because of high co-payment rate. And then in some states, families are required to pay for the gap between the state payment and private pay price. So which can bump up, the portion that families has to pay to use subsidized care. So this graph on the right side shows that for families of 3 with income at 150% poverty with one child in care, 25 states had family co-payments higher than 7% of family income. And in 3 states, the families are not even eligible because they make too much money. And some qualitative studies I have done also find that strict income and work requirements are either preventing families from utilizing subsidies or can lead to instability in subsidy use and therefore their childcare arrangement as well. And administrative burden related to when they apply for subsidies and then renewal of subsidies and then interim reporting changes also can add challenges for families to continue to use subsidies. And then the study we conducted in Massachusetts, one family talked about how difficult it was for her to get in touch with the CCR&R agency that is charged with eligibility redetermination in Massachusetts. Say, so I was calling and then I couldn't get in touch. So I just had to blow up the phone until somebody called me back. I think I called more than 12 times. I was like, I need them to answer. There is also a stigma associated with using subsidies as well. So families talked about, how they felt disrespected or instead being judgmental and not friendly. So in quotes, we are low income, but we deserve respect. Just because I work full time does not mean I don't need more help. On the provider side, there is a relatively little evidence on the benefit and challenges associated with childcare providers. But however, because of the COVID-19 and then, the great crisis that we had in the childcare system, studies are emerging for the providers that serving subsidy receiving children, and then also in general. So we conducted focus group with subsidized providers, meaning the providers who are serving kids receiving subsidies in Massachusetts. So largely, 3 things were mentioned as a benefit of participating in the program. So first one is many providers express their satisfaction or the feeling of privilege in serving underprivileged children. So one provider mentioned that I like serving those vouchers because I feel like I'm giving back to my community. And another benefit was stable funding and other supports they get by participating in the program, which include opportunities for professional training and then also resources available for families and community engagement. Especially providers were appreciative for continued funding during COVID-19. So here, providers say, I'm grateful for my voucher families because that is definitely saving us. My families that are private pay have not returned to the workforce or are working from home. So our majority of our loss was those families. However, like the family side, there are challenges as well. So first, as we mentioned and Julie mentioned, low state reimbursement rate is a serious issue that contribute to challenges in finding providers who are willing to serve subsidy receiving children. So especially, it actually adds, right, in the current context where childcare workforce present a significant challenges on its own. So graph on the right side shows that in 2021, only two states, which is Hawaii and South Dakota, paid 75th percentile of current market rate. And the one provider in Massachusetts said, so the vouchers, when we first opened, we were told by EEC, don't expect the money. It's not they don't pay, they pay, but they pay much more slowly and a much lower rate than private pay families. Also, instability in family subsidy receipt can also really, lead to instability in enrollment of subsidy receiving children in the provider side. So looking at Massachusetts data, in each school year, depending on where you look at full year or 9 months school year without summer months, about 35 to 50% of subsidy receiving children leaves providers at some point during that year. So this high instability in subsidy enrollment can not only affect our providers' financial stability, but also make adult-child relationship building and attachment challenging. So, so one provider say, the program we are having is that many parents have had their hours cut off, but then if they don't have enough hours, they don't qualify for the vouchers. They don't have that subsidy. My pay will stop. So it is very difficult to be able to help these families. And additional paperwork and meeting regulation to serve subsidy receiving children on top of general administrative and all the operational challenges that they have can add more burden in serving these kids. And finally, and importantly, providers accepting subsidies can I'm sorry, I lost. Providers accepting subsidies can serve children from various backgrounds, including many children coming from disadvantaged background. So they face a variety of challenges related to children's challenging behavior or mental health concerns or need of families. However, the resources they can utilize are generally lacking. So providers in Massachusetts mentioned that I have a child that tips over furniture, takes beats, and throws things around the room. He can't just control himself. They're loving children, but they have this behavior just sometimes we just can't manage. But however, they point out a lack of training or resources to address these issues. So one provider talked about a lack of training in that area. So those courses that providers are taking, their course load is specifically early childhood education courses. They are not taking courses in special needs. They are not taking courses in mental health. And the kids that are coming are the most vulnerable of our population. So it actually, it really speaks about, children they serve and then how little support or resources they have. And finally, there are overall challenges that many states have been trying to address for subsidy programs. So the supply of subsidized care is generally lacking. Therefore, building supply statewide and nationwide, there should be better understanding of where subsidized providers are located and where the families who are in need of subsidized care are located. And so in Massachusetts and other states, we saw some like a mismatch between where subsidized providers are located and where the families who are in need of subsidized care are located. So, which means that some places subsidized care is hard to find, but some places there's a number of vacant slots for subsidized care. And additionally, Julie mentioned we need to build childcare capacity for underserved group and underserved communities as well. So as you see, there's a lot of kids in various groups and communities, they don't have access to quality care. So that can that's kind of the big issues that challenges us. And finally, in supporting providers who are participating in the subsidy program, the state needs to explore alternative methodologies to set the rates, such as the cost models, to provide more targeted supports, and then also at the level they can cover their operating cost for serving kids receiving subsidies. Okay, so finally, but despite all these changes, I just want to highlight, we did make some progress in the program. So 12 months eligibility requirement that are set by CCDBG actually increased stability in subsidy use for many families. And then also the federal
It looks like Yoonsook might have frozen. She was worried about the stability of her internet. So maybe we'll give it just a second. And maybe Gina, you can get ready to start. Yep.
Yep, I am ready to start. Everybody, let me turn on my slides for you. Hold on a second. To get rid of my closed captioning comment.
Yoonsook, we figured you were having internet issues. Was there any final words that you wanted to share?
I just want to hand it over to Gina. The final word is CCDF is a really significant investment in the country, but it's just small. So CCDF subsidy alone can really solve all the issues that we have in the childcare subsidy system. So I just want to hand this over to Gina to talk about some insights about some bigger picture points.
Great, thanks so much.
Thank you, Yoonsook, and it's a perfect segue. So let me see if you guys can see this. Can everybody see the screen? Yeah.
Yes.
Okay. I'm assuming so. So I really appreciate being asked to talk to all of you today, and it's great to be on a panel with Yoonsook and Julie. So thank you so much, Judy, for inviting us. I've been given the challenging task of what can we do about all of this, which I wish I had the answer for us all. I would be very happy, but I don't. But I'll give you some thoughts about it. So just a quick, what I'm going to talk about is we've already heard a lot about some of these, the market challenges, that really funding is at the core issue. Where can we get money from? But I really want to spend most of my time looking more deeply at kind of segueing to what Yoonsook and Julie kind of teed off for me, which is looking more deeply at CCDF, what it can and can accomplish, and where we could go from here. So this is obvious, but I just want to be clear. We only have 4 places we can get money. Parents, and I think you heard pretty clearly that that's a orange that has been wrung dry. There's really no more we can get from parents. Government, which is the focus of this conversation today, which we'll talk about, is spending, but not nearly enough to address the need. Business, we talk about a lot, but unfortunately, first of all, business has been pretty clear that they are barely kind of on board with thinking about things like paid leave. They have generally childcare has not been a huge priority for them. And there's also, I think, some concerns about if you make this kind of an employment-based support. We have some pretty good evidence from the health insurance world that may not be the best model. But anyway, I think that's still some place to focus on, but I don't think it's going to be a problem solver. And then, of course, there's philanthropy, which always plays an important role, but is small in terms of money. So CCDF is the place we go. It is the money going to childcare in the country. So it is the only public funding that really sustainably goes to this. I do want to just mention that most of the funds, as Yoonsook said, go to pay for subsidies, which we'll talk more about. There are about 12% that states have to devote to supporting quality and supply, which we call the quality set aside. I'll talk more about that in a minute. I think my first point is just to reiterate something that Yoonsook said. We often are very critical about the subsidy system, and I will join her in my criticisms, but we have to recognize that it is doing a massive job right now. It is serving almost 1.5 million kids over 900,000 families who are able to go to work every day because of it, at 230,000 providers. It is only funded enough to serve 15% of those people eligible under federal rules. So it is nowhere near enough to meet the need of those even who are eligible. So I think that is the first thing. It is helping people access care and helping people pay for care. So that affordability chart, even though they still have to pay too much, as you showed with the copays, they are getting a significant amount of help to be able to pay for childcare. And an interesting example of this, we did some micro simulation modeling a couple of years ago at Urban, where we just said, what would happen if there are funds available to serve everybody who was working, who met their state eligibility requirements, who had incomes up to 150% of poverty, who would want a subsidy? So what we found is that you serve a lot more people. 800,000 families already working would be able to have their childcare costs reduced. 270,000 moms would join the workforce, 2 million more kids would be supported, and reduce the number of children in poverty by 3%. Just to give you an example, this is the kind of thing that we can do with the parts of the CCDF that work well, even though there's much more that would like to fix about it. But what are its limits? So we've already talked about some of the barriers and inequities in terms of access that Yoonsook laid out, talked about funding. What I want to say is that it simply cannot address the larger systemic challenges around supply and quality at its current levels. And we want it to. We desperately want it to as a field. We are always innovating, and I'll talk more about that, about ways it can do it, but it's just very, very challenging. And there's real equity questions. And I'm just pointing down at the bottom here, there's a paper that we did recently about the subsidy system with an equity lens, and I just put a link down here because there are some very interesting and challenging equity issues that both Yoonsook and Julie brought up. So I'm going to go back to the subsidy payment rates. Now we'll have all three of us talking about payment rates, and that's because that's where the money goes. That is what subsidies do, is they simply pay providers. So what we've already heard about is that what we have a lot of conversation about in our field is let's raise the rates. So raising the rates means that they're raising the cap, the maximum amount that they will pay for childcare. And that some stuff talking about raising rates overall, sometimes it's talking about rates for specific kinds of things like to improve quality or improve supply for certain kinds of kids. As Yoonsook said, the current maximum payment rate is below the 75th percentile. Is it enough to cover 75% of the market? Will enough 75% of the providers be able to accept that rate? And as Yoonsook showed, only 2 states have their rates at that level, which means that there's a lot of providers in the market whose rate just won't be covered. So a lot of them just choose, I'm not going to accept subsidies because I'm not going to take a loss. Some will do, as Yoonsook said, in the states that allow it, they'll charge the parents the difference, or they'll restrict the number of families that they'll serve just to reduce their losses, right? So when you raise that cap, what you're doing is allowing those providers who's charging more than the old cap to come into the system and serve these families. So it doesn't change the market, it changes the amount of the market that families with subsidies can get. So absolutely raising rates improves the care that parents who are getting subsidies can access in their market. The fact is that higher cost providers are likely to be higher quality because things like salaries and low ratios, et cetera, cost something. So that means you're allowing those families to access better quality in their market. So again, it does what I think the subsidy system does do best, which is it supports better access. And so raising rates is great on that front and incredibly important across the country, deserves a lot of the attention it's getting. But rates are also the most common policy strategy that we use to theoretically improve the quality and supply of care. And that's often, I'm going to pay a little bit more for non-traditional hours. I'm going to pay a little bit more for infants. I'm going to pay a little bit more for higher quality that meets quality rating improvement standards. I'm going to pay more, they just raise it. So let's say I'm making this up, $10 a day for X normal care. I'm going to pay $12 a day. And obviously you wouldn't pay $12 a day. Those are just hypothetical. But so again, by doing that, you're allowing those providers out there who are doing that thing to accept the rate from the state because they're not going to have to take a loss. So again, it's going to allow the families in the system to access those providers if they're there. But unfortunately, we don't really have any good evidence that it changes the overall quality or supply in the market in a sustained or significant way. And let me explain why. First of all, as I think Yoonsook mentioned, providers can often only get the higher rate if they charge that to private paying parents. So they can't charge the state higher rate than they're charging parents. So if you have a low-income, you're in a low-resource community, and the local market can only allow you to charge X dollars, and the state rate is a bit above that, it doesn't really make any difference if they raise it higher. You still can only charge X dollars because that's all you can charge private paying families. So the providers who are in the system whose rate is already covered, they're probably not going to be affected by that higher rate because, again, it's just raising that cap. Second, as Yoonsook pointed out, the number of kids that, that vouchers are not reliable, is what Yoonsook mentioned, but also the number of kids that are on subsidies in any given provider is going to vary very widely. And I'll show you that in a second in a graph. But vouchers are just not reliable funding sources. You saw the instability, right? So you can't necessarily say, I'm going to get this higher rate for these 10 kids, but know that you're going to have that money in a month. You can't raise salaries on hypothetical money that may not be there in a month. So it's a challenge for providers. So they have to have a stable funding base to make these kinds of investments in things like improving salaries, improving quality, changing their business models to do things like non-traditional hour care or care for children with disabilities. So it can be particularly challenging to rely on a rate strategy to do that. Let me just give you this as an example. This is a slightly complicated graph. This is the percentage, if you take providers who are serving children in the subsidy system in Pennsylvania in 2022. This is the percentage of the children in their enrollment that were receiving subsidies. And basically, you can see the blues as kind of level of saturation. So the lightest blue is providers are serving between 1 and 10% of their kids on subsidies. The next color is 11 to 25. It goes all the way up to 76 to 100%. So you can see in centers accepting children in subsidies, and across this is the percentage of providers. Of the providers, center-based providers in Pennsylvania accepting subsidies, more than a quarter of them had less than 10% of their kids on subsidies, and more than half had less than a quarter of their kids on subsidies. It's very hard to think about what you can do with any kind of rate if you're serving less than 1 in 4 of your kids and if you get that higher rate and the amount you're charging the private pay parents isn't higher. So it's a very challenging concept of how you can use subsidies. It could certainly have more of an impact in these ones at the end, the ones who are serving closer to 76 to 100%. And the numbers are very different. If you look at family childcare, and that's part because they're very small. So you're much more likely if you only serve 4 kids and you have 2 of them on subsidies, you're likely to have higher density. But it's just a really important limitation in our thinking that rates can actually change behavior. The other thing I want to point out is that funding constraints mean that states have really, really rough trade-offs to make. They have 3 policy levers they can use: how many kids they serve, how much they pay providers, and how much they can offset those payments by parent copays. And it's like a whack-a-mole game. You raise the rates, you're going to have less kids. You raise parent copays, it's like, where are you going to get the money from? You raise parent copays, you're going to have less affordable care. And then are you going to serve providers who are further away from quality and give them more money to help them come up to quality? Or are you going to preserve those providers who are almost at quality so you can get there? It's just I've often been very glad that I'm a researcher who can just say what the problems are without having to be a state administrator who has to make these kinds of choices. It's really, really rough. So they're constantly facing these trade-offs, and it is very hard for them to be able to make the kinds of decisions that we want, which is that they can fix all of these, right? The conundrums that Julie laid out up front, you fix one and you're going to make the other one worse. So what about those quality set-aside funds? Basically, they're 12% of the funds. They are a small amount of money, but there's evidence that when people use them well, they can do things like, in the short term, in that place, do things like improve compensation or support specific types of care or stabilize funds going to providers. But the problem is the impact is often localized. It's going to only affect the individuals getting that service, usually in small numbers. When the funds go away, which unfortunately they often do, the private market forces are likely to come back in and push that system back to where it was before, because the private market is simply not supporting them to be able to do that. That's why the funds came in the first place. It's kind of a band-aid that just doesn't fix the problem. Important, fixes it, but it doesn't fundamentally, systemically, long-term, sustainably fix the problem. And I think the COVID funds are a really good example. I mean, we had a massive infusion of funds during COVID relief. They expired last weekend. And over the next year or so, you're going to see the impacts of that. There are providers across the country who've been using those funds to pay their staff. The market's not going to come in and give them that money. The states can't come in to give them that money. So what's going to happen there when providers across the country are already facing massive problems getting the staff that they need? So what can we do? I just hate to say this, money, it's core. That won't solve everything, but it simply cannot be fixed without it. I also think it's really important to be honest about the limits and the constraints that we face while celebrating what we have done and really recognizing the important work that subsidies systems and CCDF has created. And I think there's things that we can continue to do to make things better. One is there's a bunch of issues that Yoonsook raised that I've done a lot of work on in my career about how do we make the subsidy system work better for parents and providers. Many of those things she talked about are fixable. Some of those are low-hanging fruit. How do you communicate with parents? What are your policies? What are your practices? How do you train your staff? We really need to do better on figuring out how do we do better to meet those full range of needs that Julie laid out, non-traditional hours, kids with disabilities. Even if we figure it out in small pieces, we'll have that information ready, because I do believe at some point we're going to have to get some money in this system and be able to implement it. So I just think continuing to innovate, exploring new ideas, testing, evaluating, learning how to do it right. There's a huge amount to learn. It's a very creative field. There are remarkable people trying to figure these things out. We just need to figure out how to get the money to use that, let them do it and do it to scale so families can not be facing these kinds of challenges. So I'm done. Back to you, Judith.
Thank you so much to all three of our panelists, excuse me, Julia, Henly, Yoonsook Ha, and Gina Adams. As Julia said, she had to leave, but we so appreciate her joining us today. I will say we have a few questions in the Q&A, and we did have some questions submitted before. I will just remind everyone that questions that deal more with early care and education workforce, we will be saving for the October 18th webinar that we are doing. That's 2 weeks from today. And we'll encourage you to register for that. I just put a link for registration into the chat so folks can go ahead and do that. I'd like to start, Yoonsook, with you and Gina, certainly if you'd like to respond to this as well. The question is, can you please discuss how the recent expiration of the federal pandemic aid to childcare relates to the topics discussed today? And I'll ask you to unmute.
So, yeah, so including CARES funding and ARPA funding, it's a little bit more than, I think, $52 billion actually came to childcare subsidy program, and then overall, not just subsidy program, overall childcare sectors that really help to provide continuous subsidies to families who've been using childcare subsidies, also providers who had challenges with, basically operating their programs, right? So, and then they actually provided wages for childcare workers, and then also cost for facilities and all those. So it's unfortunate that the federal couldn't extend that money, but we do have like a few more years to implement and distribute the money. And so hopefully the kind of setback is kind of smaller than we expect. And then also in many states, including Massachusetts, so they, in some way expected that this money will expire, at some time. So they actually supplemented and the money to support, continue to support childcare subsidy system, not subsidy and then entire childcare system. So I'm hopeful that, the kind of the negative impact that, this will have will be a lot smaller than kind of we expect.
And I would just add, I think that the answer I'd have a slightly different, I think it varies enormously. I mean, there are many states that aren't planning. There are states that started pulling back and changing their policies last year. They do have another year. I mean, it had to be obligated by last week, and it has to be spent through, depending on how the state's spending it. There's different kinds of money. Some went through the subsidy system. Some were sent to go to direct grants to programs. I think my vision is that the pro system was broken before COVID. It fractured into pieces during COVID. That money kind of helped tape it together in slight ways, but there are programs across the country that cannot get staff. The staffing problem we're seeing everywhere is very true in childcare. I'm sure you're going to be talking about in a couple of weeks. That money was part of what programs were able to use to keep staff. So I don't think we're going to see, it's not like a cliff, like whoop, but I do think that unless something comes in, like happens in Massachusetts, but I don't think happened in a lot of places, I do think there's going to be some pretty serious implications, and it worries all of us because there's programs closing at 3 o'clock right now because they just can't get enough staff to take care of the kids, and that doesn't work for families.
Thanks for that. One of the questions that we had submitted in the Q&A box is, policymakers keep saying that throwing money at the childcare problem is not the solution. What do we need to do now to keep childcare from going off the cliff? Gina, do you want to start?
Sorry. Well, I wish they would tell me what the solution was then. We have not been able to figure out. I've been in this field for 35 years. I don't know how you look at those numbers that Julie laid out and say that it's not putting money into it. I mean, the problem is, I think the real problem is this is not, you can't throw money at it. You have to invest money in it for a long time, forever, basically. Because like I said, private pay families are never going to be able to make up the gap between what it costs to provide good quality care and what they can pay. There is nobody else that can come in. So it's not a question of throwing, it's a question of investing and recognizing that it has to be sustainable and done. Whatever you thought about Build Back Better, it was going to put the investments in place to have government function to put enough money in so that was going to be the driving force, the vision of quality, the vision of whatever. And so, yeah, that's my answer.
Yoonsook, was there anything you wanted to add to that?
Yeah, I absolutely agree. So basically, we need more investment from not only federal government, but also state government. And given that, with that said, I also, want to think about, with the money we have, how to invest and then where to invest. I think that's also critical questions that we want to ask. So I completely agree with Gina. With the money we have, and then we also have this kind of the urgent issues in the childcare subsidy system. So we try to kind of band-aid on, here and there. But now I think, we want to actually think systemic way to kind of fix the system. And then one way we can do it is that just thinking more like not only the US, other countries that have more universal childcare system, thinking about how their countries are doing. I don't think 100% of countries that have universal childcare system, their money comes from the government, right? So it's more like a combination of private and public sectors. Mm-hmm. And then just it's just the example, right? Kind of thinking about how we want to invest money and then where do we want to invest money are the kind of important questions to ask as well.
Thank you both for that. I thought this was a particularly interesting question. How do policymakers and systems work to ensure that the voice of lived experience is at the policy development table? So often the needed insights from early educators, providers, and parents are absent from the policy making process. And Gina, is that something that you have seen done and seen effectively done?
So two things. One is I think it's the kind of work that Yoonsook and I and Julia do is to bring those voices exactly to the table. You saw their quotes. I've been doing that work as well, and trying to bring that reality. And I'll say that reality already has changed the law. When Yoonsook mentioned that in 2014 they changed the law to be a year that you get childcare for a year when you're authorized. That's due to us bringing the voices of parents to the table. So we didn't bring the parents, but we brought their voices. States, it is a hard thing to do, and it is something that some states are really working very hard to figure out how to do. It has to be done thoughtfully and well, and thinking about how you don't just talk to the people for whom the system is working, but also the people for whom the system is not working, which is often much harder to find those folks. But there are some states that are really trying to take this on and figuring out how do you have parent councils, how do you kind of get ongoing information from providers. I do think, however, I do worry that I think there's more what we need to be doing in general on this, as well as to make sure, again, the folks who aren't able to get through the barriers, that we talk to them, right? Because often the people that we can contact are the ones who are signed up. And if they've signed up, then they've managed to jump through the hoops enough to make it work. Not to say they still don't have great ideas about how to fix it, right? That lady who blew up the phone, right? She blew up that phone, but there are people who can't blow up the phone, and you don't hear from them. So thinking through making sure that those lived experiences are from the full range of the childcare sector, both providers and parents working, is going to be really important. But yes, I think this is something that a lot of folks are interested in doing better.
I think the Massachusetts is actually one of the states that tried to establish parent council for the early care sector. So but it takes time, right? And then also we try to include families not only who have voices, but also from the other different variety of groups, and then also kind of underserved communities. But I mean, to be honest, there's a challenges, and then as a researcher, we kind of try to help the states to bring those families, and then try to incorporate their voices. If there's of course, there's a power relation, right? But we kind of try to have more like equitable voice across the parents we are bringing, and so that their voices can be included in the policymaking decisions as well. So. It's challenging, but there is some effort in the state level as well.
Thank you. We have just a couple minutes left, but I think this is a really important question. The question is, how do you work within the social welfare system while also knowing the institutional discrimination government programs typically have? And the concept of equity had come up in, I think, all of the presentations in some way. Gina, would you like to start on that?
Yeah, it's a really interesting question and a really important question. So I think there's two ways of thinking about it, and it's a half empty or half full. And let's go over the half full for a second, because there's certainly a lot of the half empty to pay attention to. One is that, in my experience, most state agencies really are trying to help people. Their intention is not to damage. Not to say that there's not bad apples in the mix that will do bad things, right? What we found in working with one red state, not to bring in politics, but a state where the concept of equity may not be one that you want to be talking about like that, is that framing it as, how do we make the system work for the families you're trying to serve? Has been, and that's the way we framed that equity paper that I linked in my talk, is very effective, because customer service and serving people well is pretty much a common goal for most human service agencies. And if you help them say, so how do we serve people well? That means you have to understand who they are and what their needs are. Part of their needs for communities of color are going to be related to structural inequities due to racism, et cetera, for people in rural areas, for kids with disabilities, whatever equity concerns you have. It means understanding where they are coming from and what their realities are. So rural communities much less likely to have internet access. Lower income communities maybe much, have higher suspicion of having people come into their homes. Whatever the issue is, knowing who they are and making sure you're recognizing that you are designing your systems that way, that's a big step. It does not necessarily get through with the ingrained pieces that all of us carry, which is what we've learned growing up and how we have to kind of address our own assumptions and biases that we have. And that changing that culture of agencies, depending on where you are, could be much harder. It doesn't mean that our systems can't do a lot better in how they're designed, while we're also trying to fix the cultural, behavioral kinds of norms that we have that unfortunately are too common in most of us, I think, in some way. I'm not sure if that answered the question, but
yeah. Yoonsook?
Yeah, that's a great question, and I unfortunately probably don't have an answer. But I think just making easy, make things easy for families and communities who access to high quality childcare is, I think, a way to go. And so when we talk about, easy, I think Julie mentioned about, we need transportation in underserved community, and then high quality childcare should be located in that location, that community. And then also in a way that, we have to make a system that we can bring, their cultural strengths to the system. So what works for the community, and then what kind of strengths we can, embed to the system can be important as well. And then also when we talk about qualities and then when state provide any kind of incentives or something like that. So we want to be careful about what types of measures and then things we are kind of looking at in, without like intention, sometimes it can create some sort of like institutional racism or disparity between communities that have capacity and the communities that don't have. So not only kind of providing those, also kind of measuring and how we kind of how we measure the quality and then how we actually distribute funding, something like that could be very important in terms of increasing equity across the system.
Thank you both, and we are at time. So I want to thank Dr. Julia Henly, Dr. Yoonsook Ha, and Gina Adams for sharing their time, experience, and research with us today. Gave us a lot of great information and a lot to think about. As we mentioned before, we'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. Also included in that email will be a link to register for that October 18th webinar about the early care and education workforce. So thanks to all of you for joining us today, and I hope you have a great rest of your day. Take care.